Welcome to Spank University, your favorite educational resource for all things sexy. Here at Spank University, we help keep you safe by keeping you informed about all things related to sex work, sex positivity, sex activism, and how to practice safe sex. Today, we will be talking about how to protect yourself from Mycoplasma genitalium, otherwise known as MGEN, a sneaky STI that has been wreaking havoc across the adult industry. Now, what is MGEN? Infections can come in all forms, ranging from the all too familiar cold to currently incurable viruses such as HIV. MGEN was first identified in 1980, and almost 40 years later, most people have no idea what it is. The lack of awareness around this pesky little-known bacteria may be accounted for by the fact that it only affects 1 to 3% of the population. The adult industry is currently experiencing a surge in the double digits, though. This sneaky infection often presents with symptoms that are similar to other STIs and non-sexually transmitted conditions. Even sneakier, some infections are completely asymptomatic, but just as contagious. The harsh truth is that MGEN can have notable consequences, including urethritis in men and cervicitis in women. It is also increasingly resistant to antibiotics and takes weeks and sometimes months or longer to treat. Treatment isn't exactly a walk in the park and may result in further injury. If you work in the adult industry, you should know that MGEN infections among adult talent surged this past year. To make situations even stickier, there are ever-changing screening requirements for MGEN. MGEN symptoms and treatment. Since 2022, SpankChain has made moves to boost MGEN awareness. With cases on the rise, here's what you need to know. Number 1. The symptoms of MGEN may resemble those of UTI or chlamydia, such as burning urination, abnormal discharge, or unexpected genital discomfort. And like many STIs, it can lead to serious health problems if left untreated, some of which may require surgical intervention. Number 2. Women are more susceptible to contracting MGEN than men. The scary bacteria can potentially lead to later reproductive issues. Number 3. The medical community doesn't really know what to do or say about it at this time. For the time being, the NHI has stated the condition needs to be studied further and that the benefits and risk of testing remain unclear. Number 4. The guidelines for treating MGEN are evolving, but the use of antibiotics isn't silver bullet. In fact, the improper or overuse of antibiotics can make MGEN more resistant or difficult to get rid of. Number 5. It can take up to 2 weeks for MGEN bacteria to grow to detectable levels. So, if you think you've been exposed or are experiencing symptoms, you might need to wait up to 2 weeks after exposure to be able to confirm whether or not you've contracted MGEN. Testing. So, what's a sexy she, he, or they to do? Isolation and contact tracing is a good place to start. We strongly recommend that people are tested when and where they can. You can find the list of past approved testing sites here. In 2022, SpankChain sponsored the test for 1,000 sex workers to support the fight against MGEN. While we are currently out of take-home tests, our friends over at Talent Testing Service continue to offer free MGEN tests that people can add to their normal STI panel. Luckily, all past certified testing centers now offer MGEN testing, either for free or at a discounted rate. PASS is also joining the good fight against MGEN by rolling out a volunteer contract tracing protocol to help minimize the spread. As of November 13th, PASS is now requiring a negative MGEN testing within 30 days to continue shooting. For more information about PASS MGEN protocol, check out this link. Speaking of spread, please help spread the word. Knowledge is power, and the more people know about MGEN, the more likely they will be to protect themselves and each other.